Like, I'm more mobile at 70 than I was in my 20s. I was never a flexible person.
Hello, welcome to the Flexi podcast by Lema Lab, dedicated to elite performance, movement longevity, and the science behind extraordinary bodies. I'm Erika Lemay, founder of Lema Lab and a performance artist myself. If you've been following the Flexi podcast, you know that flexibility has never been about stretching further for the sake of it. It's about moving well, of course, performing at a high level, we hope so, and continuing to do so, and to do what we love for decades to come. Yet, I feel there's one subject that we have just barely explored: the fascia. I'll admit that for much of my own career, I focused on muscles, tendons, joints. I knew everything about it. Although I understood fascia structurally, I struggled to find practical applications that translated into the way we teach flexibility and movement at Lema Lab and the way I could integrate fascia in my practice. Today's guest has spent decades exploring exactly that question. Dr. Edythe Heus is a chiropractor, movement specialist, and founder of Rev6 Revolution in Motion, drawing on more than 40 years, I think actually it might be 50 now, of clinical experience. She has developed an approach that integrates fascia, proprioception, and the nervous system to better understand how we move, perform, and recover. Today, we're going to explore what that means for highly flexible athletes. This conversation is nothing short of fascinating. Dr. Edythe Heus, welcome to the Flexi podcast.
Thank you. Great to be here.
Dr. Edythe, you have spent 4 decades observing how people move. Oh my God, 5 decades. Observing how people move. What have you learned that completely changed your understanding of the human body?
When I first entered practice, within the first 3 months of being in practice, I realized that the quality of a person's life is directly related to the health of their feet. And I mean, that I was practicing in New York City, so people were walking a lot. And so I became very focused or knowledgeable on how the feet operate and the effect that they have full body and quality of life. Because I'm not only in this for helping people get rid of, injuries, out of pain, but there's a natural connection between the quality of our life, how we see our world through the lens of this body that's either performing for us or not working with us.
You just touched a soft spot for me, actually, talking about the health of the feet. So I will get back to you about that later. You're a chiropractor, but you're like so much more than that, as I said a few minutes ago. Can you describe who you are in your own words?
Oh, it's hard because everybody says, you can't just call yourself a chiropractor, but as a chiropractor, we have a huge range of ways we can practice. And I always think, gosh, if you're a chiropractor and you're bored with what you're doing, you're not very creative, because we can keep recreating ourselves. So for the first 20 years, I was a clinician working in New York City, working with many performers, neurologically compromised people, ballet dancers, just the whole gamut of performers. And that was just such a gift for me to realize that, and I was constantly keeping track of what I was finding. I was doing muscle testing, and I would see patterns. And so after 20 years, I moved to Southern California and started and created what's now Rev6, to help professional athletes and refine their movement. And so I started out with baseball players and then track and field. And all along the way, I've worked with, stuntmen. I have worked with Cirque du Soleil performers, lots of dancers in all realms, Broadway performers. So it's been a varied practice and varied experience that I constantly welcome people with new challenges. And hypermobility and hyperflexibility has intrigued me for the whole time.
And that, especially in a careers where you have to push hypermobility, it's actually why you have your special and you have your skills. So that's also nice when the therapists are interested, because most doctors would usually tell you, you have to stop that. You have to be less flexible. But what if you're a contortionist and you're earning a living out of being contortionist? That doesn't make any sense. I would wonder, have elite athletes taught you anything that contradicted what you were originally taught as a chiropractor?
Oh, everything. I actually used AI to go through my history of concepts that I was working on for 40 years that didn't actually show up until quite recently as being validated. So I trust my clinical experience. I trust what my patients' bodies are telling me to actually guide me. And then I would scramble, like, is anybody else finding this? Is this documented anywhere? So I feel as though I had to throw so much of my education, away from what I was actually learning from the human body, which is so much more complex, integrated, fascinating, logical. So, I would say, the importance of instability training, the importance of texture, the integration of, like, fascia was huge. Mm-hmm. Now, I was focusing on the muscles and the nervous system, always saying there's something other than this that's going on. But fascial science was not good. It wasn't until I heard about the Steccos. They were not coming to the US yet, but as soon as they came, I studied with them. They were the first manual therapy technique that saw manual treatment, the way I saw movement. So it's a perfect synthesis of manual therapy with Rev6. And it answers and keeps answering all my questions. There are so many things I know is happening, but the research isn't there yet. And I hope to be a part of that. Just simply having people that I've been training and working with, let's just say since COVID and I started my virtual classes, the change in people's fascia and their ability to rebound, their tone and their organization as they age goes beyond expectation. But it doesn't go beyond my expectation, because I truly hold that we haven't even touched on what's possible.
You have connected so many dots here for me. First of all, let's address fascia. I am guilty of having ignored fascia for a long time in my career. I knew well its place in anatomy, but even if I was working with so many doctors, therapists worldwide, different kinds, even maybe there were just a handful of practitioners who ever mentioned fascia, so let alone making it their practice or the center of their work. I think maybe the European osteopaths were a little bit into it, but that was that. Why do you think it's so overlooked even today? You hinted the fact that there was not so much research, but sometimes I wonder, is it because the concept is not so easily explainable and that people don't understand it, so they just ignore it?
But you know what? It actually is a very simple, logical, common sense, explanation of a tissue that connects the nervous system and the muscles. And all you have to do is be in a physical body that, like you are, that there's something going on besides your muscles that are affecting your movement. And it's just, people don't realize how organized the fascia is. Now, if you just think they're speculating that fascia runs around every cell. It's part of the cell membrane. And I have to say, clinically, that explains things that I've seen for decades. Because when I was, so in 1997 is when I that I developed my work. It was like 20 years of clinical experience. I was always looking for exercise systems that I could refer my patients to so that they would move between treatments, so it would help integrate their treatment and also help them move beyond. So I like to think of the treatment as something that releases or organizes you so that you can keep reestablishing or unwinding imbalances that you have.
We have a special offer for you or anybody listening to today's episode. Use the code Flexi, FLEXI, in all lowercase letters to receive 15% off your entire order at Lemalab or on Dr. Edythe Heus Rev6 platform. The code is valid for 1 week from the date this episode is first published.
I mean, I was so fortunate because I developed my work in like 3 months, and then 3 months later, I had one single professional baseball player. And then he got me a whole bunch of other professional baseball players, which is great because there's no, like, when you're at the top of a sport that requires so much precision, it's great grounds for testing whether or not my theories and what I put together were valid. So I'm watching these baseball players. I put them on unstable surfaces. They work out barefoot. None of this was done, in the training world until I stepped into it. And I was really an enigma because I was like 40 years old, petite woman. I wasn't a strength and conditioning coach. And on top of that, I'm not very good at throwing a baseball. So it was just like, how many guys want to say, oh, this is my trainer? They're going to think, that, oh, it's not impressive. But I would watch them on these unstable surfaces that I'd put them on. And I'm like, there's something faster than the nervous system that's making them adapt to this instability faster. And when I learned about fascia, and then you go with the concept of fascia being around every cell, so then every cell is connected. And cells die and they duplicate. So that's constantly changing the tone of your fascia. What's faster than that? Does that make sense? Because I'm trying to me, it's a really simple concept, but I want to make sure that your audience gets just how interconnected and simple it is.
That's the moment you would understand. You start to work with them on uneven surfaces and unstable surfaces, and the result was too fast for it to be the nervous system. Therefore, you thought, okay, there's something else, and this is the fascia.
Right.
And because fascia would adapt, why would it adapt so fast, actually?
Because as a cell shrinks, the whole fascial system shrinks. As the cells divide, that tension changes with the division of cells. So it's almost like and this is not really a great analogy, but think about a net full of balloons or a bag full of balloons or balloons within balloons, that as you pop one balloon, the outer balloon shrinks to accommodate that. So that's happening all the time. And, that just explained the power that we had to make changes. Also, like, that kind of cues in just from an integrative aspect is the physiology, your own cellular division, how your nervous system, how your digestive system is working. All of these are interconnected through the fascial system. It's like the communication highway between all of our systems.
I still think that probably a lot of fields overlook it because it's not, they still don't understand it properly. That's my humble thought there. I'm not sure what it's worth, but our community, as you know, includes contortionists, dancers, circus artists, highly flexible athletes, or people who need to develop their flexibility. What should they understand? why should they understand fascia, not just muscles and joint, if they want to perform well, but also preserve their abilities over time? Because you also have those who are over 40 who don't want to become, they would say just the worst word in our field is become normal. They don't want to become normal. So why and what can they do with fascia to keep their abilities?
I think it's having the concept of this interconnectedness and know that fascia glides and fascia has tone. It's responsible for your ability to, lengthen your muscles or keep your whole body long, but also resilient, because you need to have the right kind of tone and the ability to change tone. So if your demand is to lengthen, but that you need to not lengthen beyond your ability to pull you back, that's a fascial nervous system muscle organization that takes
Avoid an
place.
injury, for example.
Right. So when you're very flexible, when generally people that are very flexible, they're looking for the fulfillment and the satisfaction of that end range feeling. And that's why so many artists overstretch. They think more flexibility or more lengthening is optimal. But you do that often enough and you interfere with the glide, you start getting stiffness in some areas, and you lose organized tone and you lose organization in your nervous system. So what I commonly see, like I had one dancer that I was working with, and she never injured herself dancing. She always injured herself in yoga.
Mm-hmm. Okay.
And I couldn't, and I said, don't come back to me if you injured yourself in yoga, because that's not good for you, because she was holding positions without creating the tension in the muscle necessary to protect the joints. I mean, it doesn't just protect your joints, it protects your communication in your whole body. It protects your proprioception, a sense of where you are in space, which can, if that's dismantled or disorganized, it's so easy to injure yourself. So what happens is too much movement affects the gliding substance between the layers of fascia. It goes from gliding to being stiff. And so
because you would go too far.
Well, it's this constant irritation. So it's like an injury that then creates the densification. So then your fascia can't glide. So then something above or below where you overdid it is going to become more hyper mobile, that over time that stiffens. So you have to treat your whole body as a perfectly organized system. Like, Erika, when I watch your work and the videos, I marvel, because that's one of the things I have after, a lifetime of studying movement, is where there are disruptions in the tension, where it's not gliding the same, or you can see like, ooh, there's a little bit more tension up here than in the rest of the body. So it's visible to the trained eye, and I can train people, and I do train people to be able to see that. So I think one of the problems is also, I'm a chiropractor, but I have a passion for science and did pre-med. Plus, I also in high school had a great teacher. So we were dissecting preserved cadavers, and you don't see fascia. Fascia, as one of my patients told me, he's a robotic surgeon for female problems. And I treated him, and he called me up a few days later. He said, that was fascia, because he said, my back has never felt so good. And I said, yeah, that was fascia. He said, in my world, fascia is the shit that gets in the way.
That's why we ignore it. Yeah, it's the answer.
So, you go to medical school, and Carla Stecco, who, I believe she has dissected more unpreserved cadavers than anyone in the world. And next week, I actually am going to do a dissection lab with her. It'll be my second time, and it's just amazing. But we are taught, we don't get to actually look at living tissue. Mm-hmm. And they don't see, in medicine, they don't see the organization of it. Plus, I have to say, in the US, our fascial influencers come from a Rolfing or structural integration world. Mm-hmm. And that's very different. So I was trying to fit everything I did into a thing called anatomy trains. And I studied with 3 other fascial people. And I'm like, this does not answer any questions for me. It does not reflect how the body is revealing itself to me. And I trust my clinical experience, because I'm always trying to prove myself wrong, more than just blindly go into what someone else is telling me about fascia. And so in Rolfing and structural integration, it's segmental. Like you get 10 treatments generally, you do your feet and your knees. It's sort of like thinking that an unorganized body can actually make sense of that. Whereas the Stecco Fascial Manipulation is sequential. So I looked at their textbook and I said, finally, a manual therapy system that sees the body the way I see movement. And so, of course, I've been studying with them ever since. And it's the difference between night and day. Mm-hmm. And I feel so badly because we have an ingrained system in the US. And I watch things on Instagram and I'm like, they've never actually worked with the fascia. Like, it's very different. Like, movement is fantastic, but I use movement and my hands-on to evaluate the fascia, constantly going back and forth between treating and movement, because movement is therapeutic. And I'll see people in my classes and it's like, oof, they really need their hands-on. I know exactly where they need to be treated from where the restrictions are. But not a lot of people get to look through as many lenses as I do to validate this information and know what's like truth and what's only half truth.
I want to integrate what you said now, but I also want to understand, or if we can try to use easy terms to understand what fascia does when an athlete enters an extreme stretching position. Think about something extreme, like a very deep back bend, to talk in so people can understand.
So I keep going back to Carla Stecco because her research is so solid. She knows the morphology, like what you see under the microscope of the fascia, and she sees it in the body, coarsely, how it applies to our visible bodies. And the fascia is organized. We have different kinds of fascia. The joints have a different kind of fascia, 3 layers that are at 70-degree angles to one another. That's not a mistake, It's like you have to recognize the appreciation and how refined the body is. And it's good to know about these things, to recognize that you don't treat manually the fascia of the joints the same way you would treat the fascia that's within the belly of the muscles, or the fascia, the superficial fascia, which is right under the skin. Is that understandable?
Absolutely.
Okay, all right. So Morphologically, the fascia has collagen fibers for strength and then elastin fibers for elasticity. And people that are very flexible have a different arrangement. So generally more elastic fibers, fewer collagen fibers, but this is where it gets really interesting, is that the fibers are wavy. And when you overstretch and you hold the position, you can destroy that waviness. And that waviness is what gives us our rebound. It's what gives us our shock absorption. It's really important. So when you dismantle it by holding a position too long, sometimes you can't reverse that. Now, I'm always a believer that the body has brilliant workarounds, but I developed my program, like the exercise, about 27 years ago. And and this is not to toot my own horn, because I feel like it came through me, that I was blessed with, eyes that could see movement, and knew that I have a role to contribute to the quality of life with people. But I think what I've developed is the best for restoring health to the fascia. And 2 years ago, so 27 years ago, so I had this patient that's been working with us doing the exercise, Rev6, and getting treatment. And I think I've worked with her for over 6 years. She was doing the exercises probably for 3 years before we started to do manual manipulation. And 2 years ago, I said to her, I think your fascia is almost normal. And that's not a bad thing, meaning that she has control over the lengthening, because why would you want flexibility if you have no control of that flexibility?
No, that doesn't
You
work.
can still have flexibility, but you need strength and organization and intelligence. It's not a parlor trick how far you can stretch.
No,
or
passive
how
flexibility without the active flexibility is a bit useless, because you can't use it in an aesthetic way. You can use it in a freak way.
Right. That's I like that.
And if I need to overstretch every day because I need to get more flexible for sake of my sport, what can I do right after or during the flexibility to prevent damage to the fascia?
So I find that working on an unstable surface with texture is a great, best training device for the fascia. So doing the right kind of movements on a gymnastics ball that's the right kind of texture, because you can get inexpensive balls that are really bouncy and sluggish. You want to match the ball to the kind of tone that your fascia needs optimally to perform, to have strength, to have organization, and to have mobility. So the right tone of the right texture, the right amount of air. The instability is really important for waking up your nervous system and creating the demand that gets the brain awake, that changes the command to the muscle. And the fascia is the synapse between the nerve and the muscle.
That's very clear.
So I haven't, you have to also change, like on the gymnastics ball that I use, I'm always changing the kind of tone, and the kind of loading. Like there are some exercises you absolutely should not do without a little bit of resistance. But also in your work, there's always resistance, whether it's your body weight or whether it's, I forget the things that you hang on.
Oh, it can
that
be
you do?
anything. It can be anything.
Okay.
It can be an aerial
Right.
scoop, it can be a hoop, it can be a triangle, it can be anything you want.
Perfect. But you're creating tension that's usable and there's resistance. So, yeah. So I always tell people it's got to be unstable, textured ball, because our superficial fascia actually has more nerve endings than any other part of in our body, and it's just under our skin. So even with our clothes on, we can still stimulate our superficial fascia while we're on a ball. Now, the other thing is that not just any movement is optimal, and then on top of that, ideally you need to sequence so that each movement or each exercise builds on one another. So those are kind of and you have to be barefooted, but that's not a problem with you guys. So,
No.
yeah.
I think I did that for so many years, not knowing that the fascia was involved. So when I was at full end range, like let's think about an oversplit, at 270 degree, I would never just be passive there. There was always some sort of resistance or instability, and otherwise I felt a bit like a dead body after, like my body was not, I could not really use that on stage and in movement. So I think I just did not know that fascia was involved in that process that made me feel secure afterwards in my body. You just talked about the fact that fascia is kind of a superhighway for nerve signals. What can slow down that communication or impair that communication?
So injury, overuse, where you have that hyaluronic acid, that substance between the layers of fascia, where it hardens instead of stays glidey, that's going to completely mess up.
Would it be what they call like the overuse also of the tendon? Sometimes like inflammation, a tendon has been overused and then it's inflamed, it's irregular. Is that because of the fascia or it's because of the tendon?
So there is, I believe it's a strong statement that is being made that tendons don't feel pain. It's this fascia around the tendons that is really the problem. So the beauty of the fascia is how moldable it is. So really, under most circumstances, you can remodel the fascia with the right kind of care, the right kind of exercise, and make sure that you eliminate things where you're holding postures for a long period of time. Things where there's, like every move you make in your world has to be a full body expression. You should, like when you go into the splits, notice that your torso is lifting, notice that your head is floating, that your tension is supporting the movement that you're creating. Don't think of it in terms of, okay, this is just my hips doing this and my adductors, and you kind of forget everything from that up. And I think there are people that don't even consider their feet. I mean, it takes really awareness. Like I guess it's like embodied movement is really what's required. And it's really the fascia that's the cue to that, or the key to that, because embodiment means you are aware of all of your body parts. You are aware of your body in relation to your external environment, that you're getting clear and appropriate data from inside and outside.
That's one of my main comments whenever I direct shows at artists who are absolutely exceptional, who are the highest level, so their skills is perfect, it's been rehearsed forever, is that they forget their head. I often say, but you forget your head. It's not completing the movement. And funny, it also breaks exactly what you're talking about, because the head is probably the only thing. As circus performer, you hold yourself with your little finger whilst you have your bottom on your head, and it's very evolved. And then mostly like from the neck up, it's not doing much, and it really shows, and it's actually not aesthetic, but more than that, it's not, doesn't work.
Functional. Yeah.
It's not functioning correctly.
You're pointing something out that is intriguing to me. So, people stay with me, taking my classes, so I get to see this evolution. So as people are supposed to be depreciating, people are getting better. And like, I'm more mobile at 70 than I was in my 20s. I was never a flexible person. And to have this kind of mobility just keep on improving is exciting. So, the properties of the fascia that allow us to keep changing it and mold who we are is really critical. And so I've watched these people, and I realize that the area that is hardest to get reorganized is our upper ribs and our upper spine, and that dictates a lot of what goes on in our neck. So when I see people like way too much, disorganization in their neck and their head, and that's really critical because of all our sensory organs in our head. We oftentimes use our eyes to make up for something that our body can't sense, our proprioception is unaware of. But the area from, like here, it's called T4.
Yeah.
That whole area really is hard to reorganize. I mean, it's sort of the last thing. And okay, I want you're ready to say something.
Well, because you've just been part of my main problem. And that's the thing.
I know, I saw it when you were performing.
Did you? That's the thing, because most hand balancers have problem with their neck and like upper ribs. You somehow move everything else, but you have to be so stuck in this area. And it's only when I had an accident and I stopped hand balancing because I had a full shoulder reconstruction that I started not to have neck ache. And because I stopped this type of work that you need to put so much strain there. And of course, I've been working in a different way since then, and now it's been almost 7 years and something. But you're saying that it's the last to reorganize. So I'm a bit sad, but I'll keep going, keep working. And I have problems with my wrists.
Yeah, Erika, there's solutions to that. I mean, I can send you a little sequence to address that.
Absolutely. I'm the best student on earth. You tell me to do something like a post-surgery, I'm going to do everything exactly how I can be your guinea pig.
Perfect.
For like how to correct 25 years of hand balancing. But yeah, all of that for me is fascinating. I think I could ask you questions and then turn the whole story towards me for hours, but we're not going to do that.
But your problem will be many people's problems.
Indeed. And I see it. I see it in many people. In my own training, I've focused always on being strong at end range, because of course that's where I feel most vulnerable and where things could happen, dislocate or whatsoever. And there's just, use free way to try to be at end range and try to have some control, but it's always a certain danger. So is there anything that you recommend in your practice to reduce injury risk at end range? Like an extreme position?
Yeah, because, I see this constantly. I have to actually point out in class, don't reach your arms that far back. So I'm always trying to figure out how to get that to happen. And I know this may not be practical, but I developed a water workout with resistant weights. I mean, they're resistant because not because they weigh anything, but they have lots of fins on them. And then the same thing that are on the feet. And then I use a buoyancy belt, and that can get you to end range that it's called isokinetic. So the more power you push, the more resistance you get back. And I found that to be an integral part of training. But like I said, it's not accessible, but there are now, let's see, many, many years ago, a fellow developed an isokinetic device. And now I found someone actually last week that has re-engineered this isokinetic machine, which is what all performers like you should have as an integral part of their training. But in the meantime, when that's not available, anything like eccentric is really good training. So you lighter, coming up and then more weight going down. So that's going to help you get to that end range with strength and control, because the eccentric or yielding, does that make sense? Like if you were to lower a bag of groceries, that's 45% stronger than concentric. So you want to take advantage of that. There are some interesting things, like when I first was developing my work, it was said, don't do eccentric unless you're rehabbing somebody, because you're going to tear tendons that you're going to, I started using it and I'm like, everybody needs this. And then it's interesting because as we age, you know how the right side of your brain controls the left side of your body? As we age, both sides of the brain are dialed into eccentric, whether you're on the right side or the left side. And how do most people fall? Going down steps, going down, use lack of eccentric strength. So then there are also flywheels, which you safely give you that isokinetic, eccentric loading. So I know that kind of sounds inaccessible, but I could make some suggestions. The equipment that's now available doesn't offer as much resistance as I think you need for a high-level athlete. So, what works for us that are mere mortals versus you and the exceptional athlete is you always have to you have to challenge to their level so that their brain finds it interesting.
Yeah.
It has to override like, oh, that's just day-to-day stuff.
Yeah, absolutely. Otherwise, as we know, they get bored and nothing happens. Okay, before we move to Rev6, because I want you to introduce Rev6 properly to everybody, but I want to just ask you one question that I feel is needed. When we read that fascia stores emotion or trauma, can you explain that in scientific terms, or would you discredit that claim?
Well, I recently read an article by Stephen Kotler that the body doesn't keep the score, and it explains from a neurological perspective what's going on. And I spoke with Stephen and I said, but I know when I treat people that, you'll treat an area and you'll see like tearing or they'll get very emotional. And it's not necessarily that the fascia stores that, but the memory and the part of the brain that processes that injury or that history of that injury is still there, because we are pattern recognition beings. So when we've lost clarity with a pattern and it's restored, it's an emotional thing, especially if you're a mover. Like suddenly there's a part of your body that got reintegrated. And fascia has that capacity to do that because we have those densifications from injury that change how we perceive, say, that limb. So as we free it up, it's a very freeing experience for our brain, for our nervous system, including like our autonomic nervous system. Now it's like, oh, all right, so my blood flow in that area is different now. So that's going to give you your autonomic nervous system information that like suddenly there's this openness. So you have to consider all the other physiological things that get disrupted by fascia that's not well organized. And so I'm just going to go back to that upper back area. There's from T4 to your traps to C5 is this rich bed of blood. So any change or restriction in this area is going to send information to your brain, like your brainstem, like, ooh, the circulation's not so good. I might have disrupted blood flow to my brain. These are, so when you release the fascia from an injury, the brainstem starts to be able to settle down and you're not in a constant state of fear, even though it can just be mild. It's enough to keep you out of parasympathetic, the calm. And so it changes the decisions you make in your life. It changes how you perceive your world. We are just cracking open. I don't like using the term trauma. Because that is loaded rather than, oh, here's an old injury.
We have a special offer for you or anybody listening to today's episode. Use the code Flexi, FLEXI, in all lowercase letters to receive 15% off your entire order at Lemalab or on Dr. Edythe Heus Rev6 platform. The code is valid for 1 week from the date this episode is first published. Let's get to Rev6. After years, I think of, and tell me if I'm wrong, but after years of working with elite athletes, you developed Rev6. What were you noticing in their bodies or movement that made you think the existing model wasn't working?
Because I had 20 years of muscle testing and seeing patterns evolve, like almost everybody that had a shoulder problem had some involvement of a muscle called the coracobrachialis and the pec minor. So when you see these patterns over and over again, you know that you can correct it, but unless you restore the movement, they can go back to that same old pattern. So always looking, and practicing in New York City, I took dance class, and of course I was always the stiffest person. I was not a dancer, but I wanted to know, like, how do you get that kind of mobility, only to discover that most of their mobility was with injury. Like, I never met anybody that wasn't really in pain, that was a dancer or performer, and that they just got used to pain, and that wasn't okay for me, because pain is creating a whole additional physiological response in the body that changes tissue. So then you've got this, hamster wheel of one thing causing the other. And I knew there was a way to break that cycle. So Pilates was the closest that I came, and I was in New York, and I was practicing from 83 until 97. So, Pilates was still primarily for dancers. I went to the one studio in New York that allowed non-dancers, and it was not operating from some of the premises that I found in restoring health to the body. I love the concept of multiplanar, even though it's, in my opinion, it's not true multiplanar. I don't like the spring resistance. I love the influence of the feet, but it's very single plane. But it was the best that I had available to me. And I always knew, it's like I was trying to develop, like, I would do like a spinal line. I gave some corrective exercises to people. But then when I chose to move to Southern California and got to work with a strength and conditioning coach that was doing all of these Eastern Bloc plyometrics, different kinds of strength training, he's the one that introduced me to eccentric, isokinetic, and I saw the need for that in everyone, whether you're an athlete going for performance or you're a person that has injury that needs to be corrected and you want to be active for a lifetime. So I think the biggest thrill was, I had the exercise ball and it just was a download of 20 years of experience into just once I got on the ball and I was moving and all those patterns came, it was easy for me to create these exercises and then know how to sequence them. So to have professional athletes right out of the block for me to be able to test it and just be validated, even though I couldn't find that validation anywhere. There was like, no, you shouldn't be doing training on unstable surfaces, it's dangerous, and all these things that I was doing that were theoretically risky. But my goal, because baseball players would say, I've got 6 weeks of rehab and then I'll start working with you. And I'm like, you've just wasted 6 weeks of a very short off-season training cycle. Why isn't your rehab involved with your performance improvement? You have too much of a lag time between the end of a season where you've actually made some gains along with a bunch of injuries. You want to be able to correct the injuries, sustain the gains, and be a better athlete every single season. So the fact that I was seeing that happen was thrilling. And then another thing, because I was thinking about this for so many years, there has to be a training system that helps people get into the zone or get into flow state. And so I'm always looking for that. And I was so thrilled when Stephen Finley, the baseball player that I worked with for the longest period of time, and he played until he was almost 43. We were doing an interview with the LA Times, and he said, yeah, I call this my in the zone training. And it still like touches my heart because I knew it was possible. And fascia is the key, in my opinion, that clear, organized fascia makes it very easy for you to drop into the zone or flow state, which is such a desirable place to be for performance, for self-satisfaction.
Absolutely.
It's just like
otherwise you're in a world of distraction anyway. So that would mean that it really touches all the senses in a way that you can stay present in the training. So that's congratulations for creating something that can give that experience. I think it's very hard. And personally speaking, when I try anything else, because now that I'm not focusing on performance so much on performing, I take challenges in new. I try more new things, because obviously when you need to be on stage doing some skills, you don't want to mess up with your skills, or you don't want to reorganize anything because you're afraid it will disturb your performance. So now I'm really like touching everything and trying everything. And I would say most of the time I get bored and I feel like being distracted, because I'm used to having to give everything to my training, and a little bit of, I don't want to name styles, but it always makes me bored and I think about something else at the same time, and I'm very far away from being in the zone. So I am very much looking forward to trying Rev6 and hopefully to stay hooked to it. I would need to choose, because I don't want to keep you for so long, and I would have like another 100,000 questions. But what are the essential practice, would you say, elite athletes should adopt right away for movement longevity that would be sticking to unstable surfaces when they train?
Right. Barefooted, unstable surfaces, novelty, but not novelty for the sake of just novelty. Don't segment your training, like don't have a lower body day an upper body day, a back day, an ab day. I never understand the concept of that. More compound movements are better. The different kinds of loading is important. And really precision in your movement, like being fully engaged in every movement that you're making is critical. Like, I mean, just going through the motions does not mean that you're integrating or you're getting the benefit of that, because, strength, mobility, longevity, it's a combination of all systems working together and being optimized. So I see people doing the work that I developed, who studied with the strength and conditioning coach that I was collaborating with for a while. So he kind of took my work, and so people are doing it and they're doing really rapid movements and their position's not right. They're not doing the movement the way it was intended. So make sure that before you do any speed work, that there's real precision first. I'm trying to think of focusing in on small muscles is critical. So making sure your hands and your feet are, because in the fascia world, they're called the tensors, and they can determine the fascial tension from the hands and feet inward.
Mm-hmm.
And I think you'll see people that, like their fingers are generally like this, or their toes are curled up. You know that they don't have healthy tension. And it doesn't necessarily mean that the problem arises in the feet, but it could be anywhere in the body because of the interconnectedness that we have. And I mean, everybody that has worked with me, they always say, they come in with an injury, a symptom, and it's very rare that I ever treat their symptom area, because it's fun to track down or trace, like, where did this all start? And very often you end up at their original injury that may have happened when they were 3 or 4 years old.
And yet, I wanted to ask you about that later on, and yet when we have a surgery, we don't talk about the fascia being disrupted. And I always, when they say, no, there will be no side effect, it will heal completely. Yeah, but you cut in me. So of course you're cutting in the fascia. There will be some restriction for maybe forever. If that's the case, what to do? Because I think that people don't know, so they don't make an informed decision by having that surgery. Maybe they would like to know it before they make that decision. So I think it's important to know. But if I have to have a surgery, or I choose to have a surgery, what can I do to recover the fascia movement and communication?
I'm glad you brought that up. Kind of segues into, it validates what the doctor said about fascia is the shit that gets in the way. And surgery does create scar tissue that is a very different morphology than healthy fascia. Now, so I'm always very cautious, like if a lot of surgery is unnecessary. But in the event that you choose to have surgery, you want to make sure that as soon as you can do something that allows mobility in the area, that you get it mobile and make sure that the tissue and the part of the body above and below is well organized. So then, like, say it's in your back, but back surgery, the way they have historically done it, is a great compromise to the mobility. And they pretty much tell you if you've had low back surgery, then there's a good chance you're going to have surgery continually going up your lumbar area.
Yeah, I've seen
but
that.
I do believe that in most cases we can do workaround, but I tell people that have had that kind of surgery, and also people that are very flexible, that you can't go a day without exercising your fascia the right way. So like I give people, 3 to 6 exercises that they do as soon as they wake up, and then sometimes before they go to bed. It doesn't have to take more than, 6 or 10 minutes. It's just, I mean, you wouldn't not brush your teeth. You wouldn't not shower. So your fascia is critical.
Mm-hmm. In other techniques to help, you previously mentioned Qigong and lymphatic drainage. Is that relevant?
Very.
Okay.
I love Qigong, and I studied with a couple of Qigong masters for about 30 years. And one of the Qigong masters looked at my work and integrated it into, and he was considered like one of the gifts of China, so he called Rev6 Qigong for the Western world. But Qigong is fantastic, readily available. I also love water, lymphatic drainage, because you will get superficial fascia, because you don't want to work deeply, because deep tissue will give you momentary relief, but you oftentimes have to see it as an injury. Because it's too deep. It tends to be in one area, and then you've dismantled the organization and the tension above and below. So there are a lot of things that maybe you get a year or two out of that it really works, and then it stops working because your body can't adapt anymore. So many treatments are actually more of an injury that's buying you time rather than actually correction and integration. Now, I do love Thai bamboo massage. They use a bamboo stick and they roll your superficial fascia and they do the whole body. So, if you don't have somebody that knows Stecco Fascial Manipulation, that's very deliberate about how they treat you, it's a great all around. Like, I did one when I did a cruise. I'm like, this is great. It's the only thing that I feel safe. I do like shiatsu also, because anything that sort of has a diagnostic element behind it is important. And what this I found really interesting, and it made so much sense, is that the Stecco Fascial Manipulation sequences, many of the points follow acupuncture points. Mm-hmm. And so you can change and organize the acupuncture system by organizing the fascial system. I'm not sure that it works as well from acupuncture to fascia. And I know people get really good results with the dry needling, but I've seen, and patients of mine that have had dry needling, it's almost a bit of a scar tissue thing that I have to work around.
The dry needling.
Dry needling. But I think, it probably depends on who's doing it. You just be suspicious of any time somebody's focusing just on one area. In Stecco Fascial Manipulation, you have to do 3 points, and they have to be in different body parts, different areas. So that's just kind of a point of reference that, I've seen it over 50 years. It validated everything that I've seen clinically. And I'm always learning, but I'm very, if there were a better system than Rev6, I'd be doing it. If there were a better system than Stecco Fascial Manipulation, I'd be doing it. So I'm only invested in finding the most efficient, most successful system that helps people become really the person that inside they know they are, but they can't express it.
Mm-hmm. I want to get a little personal because for me, you're the picture of vitality, and I know what you use for training, but would you share some personal habits, lifestyle, or what's the greatest influence on your own longevity and vitality, just so people can copy you?
Well, thank you for saying that. I don't know where I'd be if it weren't for Rev6. It satisfies my desire for movement and my desire for embodied movement. It keeps my attention because I'm probably would have been diagnosed as neurodivergent as a kid and ADHD, whatever, it doesn't matter. It affects my autonomic nervous system in such a positive way. So I teach 6 classes a week, so I get that's built in. And then I need to be outdoors. So I live in Southern California, so I like to hike, bike, paddleboard. So for me, being one with nature is really critical. I eat really, really well, and I have for a long time. I avoid inflammatory foods, and I do have a diet that's available that people do for 2 weeks, and it actually changes the health and the tone of the fascia. And, I do as many things as I can to help me get into flow state, creative things. And I'm pretty good at recovery. So recovery is more important than anything. And I think that, we're speaking to high performers that don't know about recovery or how important
until they need to start to know about it. I think then it catches you back.
And sleep's really important.
Part of recovery. That all makes sense to me. One last question. If every member of the Flexi community remembered just one thing from today's conversation, what would you want it to be?
Ooh. I would say learn your body, know your end range, and train to have strength and certainty through that whole range.
Anything else you'd like to share with the Flexi community before we let you go?
Well, it's really a privilege to be speaking to your community because I've been tracking people with your kind of fascia and mobility my whole career. And to finally, even in the fascial world, when I started about 15 years ago with the Steccos, it was not considered. The change in, the fascia between hypermobile people and, non-hypermobile. And you are presenting science with I think one of the greatest experiments that is out there. Plus, there's an increase in the number of children that come into the world more hypermobile and hyperflexible. So we need to start children, doing the right kind of exercise to help their fascia, to help their learning skills.
Fantastic. Thank you so much for your time, Dr. Edythe. And we will certainly be in touch, and I will make the trip to California, Southern California, to experience your treatment and understand better what you're doing, because I think you're changing a lot for everybody. Thank you.
Well, thank you. I look forward to meeting you in person.